But right now, listen to this. Better nutrition and a healthy lifestyle can prevent about 82% of heart attacks. 82%. And we know this because of groundbreaking research conducted by our next guest. Here's our own Chef MD, Dr. John LaPuma, with more.
Thanks, Leeza. You mentioned just one piece of information from the Nurses Health study, a study that's been incredibly important to physicians over the years. Here's some more information about the study.
The Nurses Health study was started in 1976, originally as a way to track the long-term effects of birth control pills on women's health. Today, over 100,000 nurses send in detailed questionnaires every few years, tracking such things as their diet, exercise, and major life changes. The study has helped us understand some very important information about women's health. For instance, you may want to put down that steak, but pick up that glass of wine. The study found both have effects on cancer and heart attack risk. To date, more than 250 scientific papers have come from this one incredible study on women's health.
Joining me now is Dr. Walter Willett of the Harvard School of Public Health. Hi, Walter.
Glad to be here, John.
What would you say is the single most important finding from the Nurses Health studies?
Probably our most important finding has been the adverse effects of trans fat on risk of heart attacks and diabetes, and that's led to the inclusion of trans fat on a food label and its elimination from many products.
Has the study identified foods that women can eat that actively help prevent heart disease?
We found that foods that are high in unsaturated fats reduce blood cholesterol levels and help prevent heart attacks. And of course, there are many such foods. That would include foods like nuts and avocados and things that for a while had been thought to be not so good for us because of their high fat content, but in fact it's healthy fat.
Walter, I know you're an expert in nutrition and infertility. Is it true that the same foods that help women get pregnant are the foods that help fight heart disease and diabetes?
The foods and the nutrients that are good for a healthy cardiovascular system, a healthy endocrine system, are also similar to the foods that are optimal for a healthy reproductive system. Also, being physically active and staying lean is good from the standpoint of fertility as well as cardiovascular disease and diabetes.
Are there steps that women can take in vitamin D or in calcium intake or in both to try to prevent fractures?
Most people in the United States already seem to be getting enough calcium, and adding a lot more doesn't seem to do anything further to reduce the risk of hip fractures. In contrast, most Americans are short on vitamin D, and probably the best way to make sure that we get enough is to take a supplement, at least 1,000 international units per day. And it's always really important to emphasize that one of the most important things to prevent hip fractures is to get plenty of exercise because that keeps the bones strong.
Walter, thanks so much for your work.
Thanks, John. It's been great to talk to you again.
For Health Corner, I'm Dr. John LaPuma.